Welcome to Burlington's Candidate Forum. My name is Alan Foles and I'll be moderating the discussion. I'm joined by a press panel to ask the questions. On my far right is NICCI KADILAK of the Burlington Buzz. Next to her between us is Chris Flaherty from here at BCAT News. At this session we focus on the race for the Board of Health. We have 3 candidates for 2 3-year positions. Ed Weiner is a longtime incumbent of the board, 33 years I understand. Janice Cohen is a former middle school teacher. She has taught about the consequences of climate change and the disposal of hazardous material. GAYLE DAMORE is a middle school health educator with 15 years of experience. Welcome, everyone. I'm going to start with the ground rules. Here's how we will proceed. Each candidate will offer a 1-minute opening statement. We've drawn lots for the order. After that, our press panel will ask questions of the candidates. Each candidate has 90 seconds to answer. We'll alternate between members of the press panel and will rotate through the candidates for first response. Next, each candidate is allowed to ask 1 question of the other candidates, again with 90 seconds to respond. The questions must be answerable by both of the other candidates. Finally, each candidate will give a 2-minute closing statement. We'll use the same order as we did for the opening statements. The closing statement is the opportunity for rebuttals to statements made by the other candidates, if they wish. In the interest of covering as many subjects as possible, we'll try to keep a close watch on the time. So now, if everyone is all set, I believe we drew the name of Janice Cohen as first.
Yes, I would like to thank BCAT for sponsoring this forum, giving us the chance to let the community learn more about us. My name is Janice Cohen. I have lived in Burlington for 44 years. I have worked to help others during my career by teaching science to students with and without disabilities at the middle school level. Since retiring from teaching, I have worked with families and schools to help children receive the services they need to thrive. I want to support the elderly of Burlington and help meet their needs. I would like to continue helping others by serving on the Board of Health. I am looking forward to serving Burlington and humbly ask for your vote and support on April 9th. Thank you.
Thank you very much. And now we move to GAYLE DAMORE.
Hi, my name is GAYLE DAMORE. I've been a resident here since 2001. My husband owns his own business here in the town. I also have 2 children going through Burlington High School. Running for the board just seemed like a logical step forward in that I want to be able to continue serving our community in a broader capacity. Over the years, I've been very involved in the community in many different ways, and I'd like to continue to give back in a bigger sense. I've been a town meeting member since 2019, and before that I worked on a small subcommittee through the school board with Kristen Russo to strategize and implement the development of the elementary health program here in Burlington. Professionally, I'm a health educator at a middle school. I've been doing that for over 15 years. I have a master's in education. I also am a member of the community impact team, the Youth Substance Use Prevention Coalition in North Reading. This coalition focuses on partnerships between schools, police, parent associations, and the Board of Health to help support youth at risk. I have recently earned a teacher leadership certificate, which would allow me to bring a fresh perspective to the board and continue collaborating with the members of the board. I would like the opportunity to serve the town, and I look forward to working with the board members to move the town forward after the wake of the pandemic. My professional wheelhouse fits well with the realm of the responsibilities the board is charged with, and I humbly ask for your vote on April 9th.
Thank you. Next is, who do we have? GAYLE DAMORE is next. I'm sorry, who?
I don't want to go yet.
You don't get. I'm sorry, I missed Janice Cohen.
Dr. Ed.
Yeah, Mr. Weiner, okay?
Good evening, everybody. I'm Dr. Edward Weiner. Most people call me Dr. Ed in town. And for more than 30 years, I've had the privilege to serve the town of Burlington as a member and its current chairman of our Board of Health. With an undergraduate degree from Northeastern University and a master and a doctorate from Boston University, I'm a clinical and biomedical scientist with extensive community public health experience. Now, under my leadership, the Board of Health has become a key agency within our town, providing safety and wellness to every citizen within Burlington. I've continuously worked to assure a safe environment, demand proper land use and town development, including our new biotechnology, and strive to maintain a high quality of life for this community. I feel privileged to live in the town of Burlington and to give back by serving as a member and a leader on our Board of Health.
Thank you. Now, one slight change in the program. We had a third member of our press board who is not here, but she did submit a question. That's Melissa Russell of the Burlington Union. I will ask that question for her. This is to all of you. What are the most urgent issues the health department will have to address in the coming year, and is Burlington up to the challenge? And we'll start with Ed.
I think it's clear. I think it's a return to normalcy. During the pandemic, the Board of Health and I, as its chairman, maintained all our responsibilities on top of all what we needed to do to prioritize the safety and wellness of everybody during the pandemic, and we completed everything from land use to ensuring responsible development, drainage and flooding, working on a historic town contamination, and our traditional public health, screenings, vaccinations, communicable disease monitoring, and food establishments. We did it all, but we had to postpone certain programs. Now that our COVID situation is an endemic situation, we need to get back to the many programs and activities that we've done in the past, that we've postponed. We've already started, but we need to talk about food safety again. We have to train the community and stop the bleed, emergency tourniquet trainings, suicide prevention, psychiatric emergencies, diversity training in our community, and get back to our annual health fair. We need to get back to normalcy. We need to continue what we're doing, but we need to go back to where we were prior to the pandemic.
Thank you very much. All right, second, we will call on Gail for the same question.
Would you mind repeating the question?
Sure.
Is that allowed?
What are the most urgent issues the health department will have to address in the coming years, and is Burlington up to the challenge?
Well, I certainly think that the board has proven itself to be an entity. They do things well. They worked through COVID well. And I think that we do need to start getting back to normalcy, whatever that normalcy will be. We're trying to muddle through that. After the wake of the pandemic, there's so many good things that the Board of Health was doing prior to the pandemic that we need to try to bring those back. And one thing would be to try and communicate those things that are being offered to our residents so that they know what's going on, when it's going on, and they can attend. There's so many great things, between simple food contamination to stop the bleed to a whole bunch of other offerings through the BVRC. So I would like to get back to doing those things and seeing them offered for residents.
Thank you. And Janice, the same question?
Yes, thank you for that question. In anticipating some of the issues, I did go to the Burlington Board of Health, and I discussed this very issue actually with Director Susan Luminello and Associate Director Michael Green. And both of them had said was transitioning back to a pre-pandemic mode was really where we needed to go right now, that was a very important task. They also spoke about restoring or expanding programs, one of the programs being the Matter of Balance, which I personally would like to see expanded because it deals with falls for the elderly, falls that happen a lot with the elderly, and reinstating the health fair that will occur again this May on the town common. They also are being faced with updating the tobacco regulations to align with the state tobacco regulations, and I would like to work on the subcommittee for that Susan Luminello said that would be forming. Finally, continuing to bring biotechnology businesses to Burlington safely, ensuring that they adhere to all of the biological safety regulations is a very important task, and that it's done safely. These are just some of the main issues that I feel the Board of Health will be working on in the immediate future.
Thank you. And now we'll go to our press panel, and we'll begin with Chris Flaherty.
Thank you, Alan. Should COVID-19 numbers start to increase again, what actions should the board take at stopping the spread, and does that include a mask mandate?
And we'll begin with Janice Cohen.
Hi, Chris. Before we would determine whether or not there was a mask mandate, we would have to get some information, such as what is the rate of transmission in the community? Does it warrant that? This next question would be whether surrounding towns also have a mask mandate and how their rate of transmission compares to Burlington's. The next question would be how are mask mandates being enforced in communities that have such mandates? Next, comparing the transmission rates before and after mask mandates were implemented in those communities with mask mandates. Finally, what the recommendations from the State Department of Public Health are. I think it's very important to look at the data, to look at the facts, and to do what is in the best interest of all citizens of Burlington.
Okay, thank you. Gail, the same question?
Thank you for the question, Chris. I think that there's so many different angles that you could answer this question in, but I think we have to listen to the science and see where the numbers really are. How are things being transmitted? Do we have to go back to masks or not? We won't be able to predict the future. I think that we do have a duty to our community to keep things safe, but we also have to hear what the community wants in regards to being able to maintain a normalcy of some sense, but also being safe. Now, everyone has their own opinions, and this is the hard part where you actually have to make your decision. But I do agree that we need to look at the numbers and the science and see where we're at.
Thank you. And finally, Ed Weiner.
As you know, the Burlington Board of Health was split on this question, 3-2 against mask mandates. I, however, was for a mask mandate. I took an oath to protect the people of this town. I have seen people within our own community pass away from COVID-19. It's not pretty. I've had good friends pass away. My neighbor across the street died. I think we need to look at the virulence. We need to look to see how dangerous the situation is. Now, today's reports, COVID-19 is creeping up again. However, there are no people in ICU in Tufts Medical Center. It's a complicated issue. It's a political issue. But for me, it's very simple. I want to protect my friends, my neighbors in this community. 1 million people in this Commonwealth of Massachusetts or so have died of COVID. 6 or 7 million throughout the United States. If I can prevent 1 death, one death of a pregnant woman, a child, an elderly person, if it gets to a point where COVID-19 comes to a level where it's dangerous, I guess I have to go with my thoughts, following the science, and the oath I took to protect the people of this community. It's not about politics. Putting a piece of fabric on your face may save you, it may save a member of your family.
Thank you very much. Now for our next question, we go to NICCI KADILAK of the Burlington Buzz.
Thank you. In recent years, racial and economic disparities in healthcare have been more widely recognized. If you are elected, what can the Board of Health prioritize during your term to address these disparities?
And we begin with Ms. DAMORE.
I feel the economic disparities across our town are there, and we can't ignore it. I also think that we have to look at the access to health care and where is it not happening, where is it happening, and how do we help get the access there. I know that there have been some programs put into place. For example, a student at the high school who may or may not have been able to access health care was then not allowed to play sports, so they were able to work something out and get him the health care he needed so that he could have a physical just to be qualified to play sports. So I think every situation's a little bit different, and you really have to look at what the need is and how can you address solving that need. And it is across the board. It comes up in different places. It might even be there with the seniors. With recent budget cuts announced at the state level, is that going to trickle down to town levels, and how do we help our seniors? Because that is a big part of our community. So we would have to think about that angle as well.
Thank you. Same question, Ms. Cohen.
Yes, thank you for that question. There are economic disparities in healthcare, and that is it is unfortunate, but yes, it is true. One of the things that the Board of Health is already doing to address that is they will offer free vaccinations for children entering the school system who don't otherwise have access to those vaccinations. One thing that I would like to do, there is a program, Mass Healthy Smiles, where Department of Public Health dental hygienists will come into the town with parental permission. They will go into preschool through the middle school, and they will provide children with preventative dental care. It could be while they're waiting, after they've applied for Mass Health, but while they're waiting to get onto Mass Health. This is a program that's operating in several other communities, and if I am on the Board of Health, I would look into bringing this program to Burlington to try and address that.
Thank you. And finally, Dr. Weiner.
The Board of Health months ago noted that racism is a public health issue. Disparities in health care are not only throughout the country, they're right here in town. We have experience with this issue. 20 years ago, in response to the disparities I saw in middle-class poor here in Burlington, I set up a free clinic with Leahy Medical Center, where physicians and student physicians came to this town and saw people who did not have health insurance and who couldn't afford their medications. These students saw each and every person who came that in the evening, and they were followed at the clinic. It's a different world now. It's very complicated. I think the board has to be a resource for those people who can't afford medications. We need to be a resource for people who can't afford certain health screenings. Or, as we have done in the past, I have set up screenings through grants, which I got from instrument companies. It's a tough situation for the poor. It's a tough situation for middle class. The Board of Health can be a resource, the Board of Health can assist, and the Board of Health can work to help those people who just don't have health care. It's a shame that I have to say this, not only in our country, but even in our community.
Thank you. Let's see. Okay, we're on to our next question. We go back to Chris Flaherty.
Thank you. What role does the board have in regards to regulating the biotech industry in Burlington for safety, but also encouraging its ongoing development?
And we'll begin with Ed.
Science and biotechnology. What's going on and what's safe? Well, first, our town is quickly changing. It's clear that Burlington is rapidly becoming a hub of science and biotechnology. Although there are approximately 20 federal and state agencies that work to ensure safety, the most important group in this community is the Board of Health. We are key, and we are vigilant in protecting this community. Now, how do we do that? Well, we first created a comprehensive regulation in 2020. This was based on the incorporation of earlier RDNA requirements that we had set up for companies who were thinking of coming here. We review every company, every healthcare institution, and every academic research laboratory, and we have all three examining every aspect of their science. A member of the Board of Health and a community representative sits on every group's IBC, their Institutional Biosafety Committee, and we routinely inspect. We inspect these scientific institutions. And last, and most important, the Board of Health and our public health officials, and I as chairman, and a doctorate in life science, are committed in providing continuous oversight, continuous transparency, and safety for this town.
Thank you very much. Same question to GAYLE.
So the biotechnology that's coming into our town plays a big role, especially with the Board of Health managing that. But also, I'm excited about the empty office spaces being utilized. And there's been two sides of the story, with people being worried about traffic and more people coming into town. But I believe that there will be less in regards to the fact that office cubicles are going away and a lab will be put in. Yes, that includes bringing in more employees, but usually when you work in a lab, it's off hours or it's continuous, so they're not all going at the same exact time. So it might alleviate some of those issues that people are worried about, but I also think that the board plays a big role in regulation and making sure that the questionable chemicals that may come in along with the biotech companies are properly disposed of. So I think that's where the Board of Health would come in, and I would like to be a part of that and help grow our community.
Thank you. And finally to Janice.
Thank you. There are many empty office buildings in Burlington. As you drive around, there are Felice signs everywhere. And a lot of this was from the pandemic, where people were adopting a hybrid work model or work from home. It's important to fill these spaces for the economic health of Burlington. And the biotech industry has come to look upon Burlington very favorably. The Planning Board actually began working to attract biotechnology into Burlington in 2019. And at that time, a life science forum was held where members of the community, town meeting members, different boards were all invited to participate. At the end of 2019, there were new zoning regulations were discussed and the zoning changes came before town meeting in January of 2020. The Board of Health enacted the biological safety regulations for the permitting and oversight of companies using regulated biological agents. That includes not allowing hazardous chemicals to be emitted into the air or into the soil. So these are, the Board of Health is heavily involved in the safety of these industries, and they are coming into Burlington and in a safe manner and should continue to do so.
Okay, thank you. Now for the next question, we go back to Ms. KADILAK.
Thank you. Where's my question? Okay. What are the dangers posed to Burlington by climate change, and what can the Board of Health do during your term if you're elected to mitigate those dangers?
Okay, we'll start with Janice Cohen.
Thank you for that question. Climate change is already here. It is causing more severe storms, flooding, more rains, and it is a health hazard, as standing water presents a danger to young children and also to an increase of insects, and that can cause disease. It is important to address climate change, and the Board of Health, I think, is doing that by monitoring the water and also by having safe chemicals. They're using very safe chemicals to deal with the mosquito population. This is something that we'll have to continue to keep an eye on and work towards protecting our environment.
Thank you. Same question, Ed Weiner.
We need to acknowledge that our environment is changing. The Board of Health needs to address the public health effects of environmental change and global warming. The community continues to experience more drainage issues, standing water, flooding, more than we've seen in the past. And it's not just in the new developments that we're seeing this, but in residential neighborhoods, in our backyards, in our cellars, and places where our kids play. Now, the Board of Health has started to and needs to further prioritize solutions for these problems, leading the efforts for all town boards and commissions to study this issue, as well as ultimately looking at the long-term effects of wellness and safety and the impact of our quality of life, and make appropriate changes in our local regulations and in policies and future direction in our town. It's a complicated issue. It's not only flooding and drainage, it's much more. It's mosquito populations and tick vector populations. It's possible that it might even affect the cleanup of the town's contamination, as well as how we live and play. Well, just last week I called upon my board to find innovative ways that we can work with homeowners and neighborhoods to attenuate these environmental issues. These programs are not going away, and we need to acknowledge them, and we need to come up with the solutions for everybody.
Thank you very much. Okay, we move on to our next question from Mr. Flaherty.
I don't think
I
Mr.
think-
Moore answered this question.
Oh, I'm sorry, I'm doing that all night here. Yes. Okay, go right ahead. I am sorry about that.
That's okay. Thank you for acknowledging that. I think that climate change is a bigger deal than people are aware of, but we're seeing it happen before our eyes and then questioning why this is happening. So we have to go down to the basics and start looking at different ways to be able to deal with the things that are changing. Where weather is crazy, the winters are not as bad, but then they're moving into getting storms later, things of that nature. How does Burlington and the Board of Health deal with that? Looking at things such as the standing water is an issue. Mosquitoes are populating. How can we get rid of the mosquitoes so people can simply get back to the basics, enjoy their backyards, kids can play sports without disrupting the environment further? That's the question. I don't know if I necessarily have the answer, but I am willing to work towards finding an answer and working with the Board of Health and other boards in town to collaboratively put something together so that we can all work towards a common goal.
Thank you. All right, Mr. Flaherty, your question.
All right. How can the Board of Health best help restaurants adapt to the ever-evolving COVID-19 situation while supporting their continued success?
And this time we'll start with Ms. DAMORE.
I feel like that's a tough one. The board is in charge of regulating the food safety for our residents, but also allowing food industries to thrive. So how do we help? I think we have to look at what do the restaurants need? What do the people of the town want? How can we collaborate to make this work for everyone? We are in the wake of a pandemic. We're trying to get back to somewhat of a normalcy. How can we do that and allow businesses to thrive, but also allow residents to enjoy? It's a question that, again, we'd have to work towards finding solutions, and I'm willing to do the work to do that.
Thank you. Dr. Weiner?
The Board of Health is a regulatory agency. We work with restaurants to make sure that they are safe, that they provide food that is not only wholesome, but also safe for everybody. Now, Burlington is an international community, whether we believe it or not, and people come from here from all over just to come to our over 200 or so food establishments in Burlington. We work with each one of them to make sure that they are in compliance with the food code. And if they're not only do we cite them, and not only do we re-inspect, but we also train them and show them what they're doing wrong. We're a partnership. It's a partnership between the food establishments in Burlington and the Board of Health. We want them to survive. We want these restaurants to do well, but we want to ensure everybody in this community that you can eat anywhere in this town and not worry that you're going to get food poisoning and not worry that you're going to have problems. Now, it's true we have shut down restaurants. It's true we have shut down food establishments, but we've worked with them to reopen. It's a partnership. With any good Board of Health, it's a partnership between business, between its residents, between its visitors, and the Board of Health.
Thank you. And finally, Ms. Cohen.
Thank you. During the height of the pandemic, in the spring of 2020, the State Department of Public Health instructed the local boards of health the standards that they needed to adhere to. When the mall was shut down, that was coming from the State Department of Public Health. When various restaurants and stores were forced to close, that was coming from the State Department of Public Health. The state will dictate when, or if, hopefully never, things would have to close down again. Some of the safe things that as things started to reopen, that the restaurants did, they had outdoor dining, which was very safe. When it got too cold for the outdoor dining, they had spacing inside the restaurant, social distancing, which was very effective. Some of the restaurants put up plexiglass in between the tables wherever they could, which was very effective. It's important to try and keep the restaurants open as much as possible, but to do it in a safe way. And we should follow the lead of the state in doing what they say, but also putting in some safe precautions in with the restaurants themselves.
Thank you. And for the next question, we return to NICCI KADILAK.
So all of these questions have really highlighted that COVID-19 is everywhere and it has permeated everything that we've done. So here's another COVID-19 question. It's actually not about COVID-19. 10 years from now, let's say another pandemic, God forbid, happens. What have we learned in the past 2 years of managing COVID-19? What would you do differently and what would you keep the same?
Thank you. And we'll start with Ed.
Well in advance of the COVID-19 pandemic, the Board of Health had developed emergency plans and emergency procedures, just in case. We had equipment at the ready, transportation. We had set up protocols, and we worked with our Burlington Volunteer Reserve Corps that we sponsor to work with us. We practiced our plans using the full flu clinic as an emergency drill. Could we vaccinate the community? Lots of people. Could we affect them in a very short period of time? Unlike so many communities, we were ready, and not with just vaccinations, but with contact tracing, a source of credible information in a sea of misinformation. This Board of Health was ready to go. 10 years from now, this Board of Health will be ready to go. We continuously keep our storehouse filled with emergency material. We continuously drill with our Burlington Medical Reserve Corps, now called the Volunteer Reserve Corps. We will still have everything in place. We still be ready. And if emergency breaks out, we will be there.
Thank you. Same question, Janice?
Yes. Hi. We have learned a lot from this pandemic. At the beginning of this pandemic, back in the spring of 2020, there were not enough supplies for healthcare workers. There were not enough masks. There wasn't enough equipment for the hospitals. And we didn't even realize this was an airborne illness, and people were being discouraged from wearing masks. We have learned a lot. If this were to happen again, and hopefully it never does, we should have supplies, protective PPE, for all healthcare workers readily available. We also need a more efficient rollout of vaccines. I realized that the Board of Health had the COVID vaccines ready to go, and it was unfortunate when Governor Baker said that we had established these mass vaccination sites at Gillette Stadium and at Fenway Park. This made it difficult for a lot of elders to get their vaccines because they couldn't get to these locations. So hopefully the vaccines can be given out locally next time. We also, I think, should have more efficient coordination of health information to the community so they realize the safety of the vaccines and the importance of the vaccines, and we don't have to see more people lose their lives needlessly because they were afraid of the vaccines. And finally, better communication regarding disease prevention strategies, again, so people do not have to get sick needlessly and suffer needlessly when it could have been prevented.
Thank you. And finally, Gayle?
Well, thank you. I do think that whenever you go through something, you learn a lot. What can you take away from this past pandemic and learn from and then move forward? There are so many different aspects. I think it's hard to pinpoint them all, but I think some of the important takeaways would be the communication piece of things. People not truly understanding what the virus was about, being afraid of possibly using the vaccinations. There's so many different areas of misinformation that I think that we need to do a better job of communicating to residents, but also allowing the access to what they need. The question becomes, how do you implement that? And that would be something we'd have to start working on now for then. And that's the biggest thing, collaborating with other boards. The Board of Health did a great job dealing with what we were given and implementing what we could do. The state does oversee and regulate a lot of the regulations, so your hands are tied. You have to do what the state says, but you can also communicate and better prepare the residents so that they have a better understanding and are able to work with what we have.
Okay, thank you very much. We now move to the next section of our presentation. This is where you get a chance to ask each of your fellow candidates a question. We'll begin the questions with Janice.
Yes, thank you. I'm asking the question to both of them at the same time. Okay. My question is, what do you think are some of the most significant accomplishments of the Board of Health over the last few years?
And we'll start with Gayle.
I think the way that they handled COVID was a big thing. There were so many different aspects, and they had to handle so many different things in regards to vaccinations, making sure that people had what they needed. I know that there was a call out for residents to simply start sewing masks and help and drive them to places. So the board handled recognizing what their residents needed and how can we solve that problem. I think that they're constantly looking to serve the residents the best that they can while upholding the mission of protecting and being able to serve the residents of our town. I think that promotion is a big thing where you have to let people know what's going on and why. And I'm thinking that the preparation, or I guess if there was a pandemic in 10 years, the preparation of happening, already been going through it, would be enough to prepare the residents to understand that the board is looking out for their best interest.
Thank you. Same question, Ed.
That's a great question for me. Thank you. I could talk about all the things that the Board of Health has done and how we evolved from a small group of individuals to a group of highly trained people within our board that now handles any emergency or any issue within the town. But I'd have to talk about the emergency planning that we did. We worked on emergency planning for years and years. We drilled. We developed a Burlington Volunteer Reserve Corps. Yeah, the Burlington Board of Health developed it and ultimately went to Washington to become an independent group. We were ready, and that is one of the most important things that I am proud of. And the other, we have been a key in the development and redevelopment of this community. From an office-based Burlington to a hub of science very quickly, a hub of science and a hub of biotechnology. We've developed the comprehensive regulations to protect this community. Not only regulations, but also regulations in smoking, vaping, animals, rDNA, and now biotechnology. And last, we've done some very innovative programming. We brought this community so many programs and trainings, from psychiatric emergencies to suicide prevention, from Narcan drug overdose training to stop the bleed emergency response. And just recently, we just started again with new programming, food safety, stress and anxiety programming, a lot more to come. This isn't your grandfather's Board of Health. This is a major professional organization, and I'm very proud of it.
Thank you very much. For the second question, we go to Gayle.
With the town being able to do so much already, but the state threatening and looming budget cuts, how do you see the residents of Burlington getting those newer implemented programs that were addressed earlier.
Okay, we'll start with Ed.
If you watched the Board of Health meeting just a few days ago, you saw that this Board of Health is not taking a step back. We're keeping our budgets flat. However, we have gone out and we've received a number of grants. We just received a federal grant for $19,000 from the FDA, and we'll use that grant to update our regulatory work with all of the food establishments in this community. We just received a RISE grant for $25,000 to help us do new trainings and new emergency planning for this community. If we don't have the money, we're going to seek the money. We have done that. We have received grant money, and we will allow, which will allow us, it'll allow us to continue what we do and lead the Commonwealth in public health.
Thank you. And Janice, finally.
Yes, thank you for that question. The Board of Health goes before the our town administrator, and they develop a budget that is within, that they know that they can meet within the town. And also, as Dr. Weiner had mentioned, they have received several grants recently, and those grants are allowing them to expand the programming that they already are doing. So I think that the Board of Health is not totally dependent on the state for instituting its programs. Their money is coming through the town and through grants that are being written by the professional staff of the Board of Health.
Okay, and for our final question, we go back to Ed.
The first meeting of the Board of Health after the election is 3 days. What have you done to prepare yourself to come to a meeting and understand and to participate with all that we do?
And we'll start with Gail.
Well, I personally have been a fan of the Board of Health, so I've been watching you since before the pandemic in regards to reading your minutes. I watch the televised shows on BCAT, so I am a BCAT fan as well. But I started pulling annual reports and looking at the past and seeing what you've done, but also trying to mesh it with what you propose for goals and setting things up in regards for the board to be successful with what they do. And I think that's the biggest thing, is being knowledgeable, learning as much as I can, and then also understanding that I'm gonna do the work to uphold the mission, and I do wanna help you be successful.
Okay, and finally, Janice.
Thank you. Shortly after I took out the nomination papers for the Board of Health, I began very closely watching all of the Board of Health meetings and going back to previous Board of Health meetings. I watched very carefully the most recent Board of Health meeting this Tuesday, so I would be on top of the issues that they are under consideration. I also went to the Board of Health office and sat down with Director Susan Luminello to find out more about the Board of Health, what they were working on, and I also sat down with Associate Director Michael Green to find out what he was working on from the Board of Health. I have read about the Board of Health programs and their accomplishments in the annual town reports beginning with 2017 through 2020. I have also been reviewing the Board of Health regulations. I've come to find out they have many, many regulations, and such as the biological safety regulations and the stormwater regulations. So I have made every effort to familiarize myself with what they are doing, and coming up, if there's something that I am not familiar with, I will go back and talk to Director Susan Luminello or Michael Green or any other staff and make sure that I am fully informed and up to date on any issue before the board and that might be discussed at their meetings.
Well, thank you very much for all your questions. We are now up to closing statements. And by lottery, we begin with Janice Cohen.
I would again like to thank BCAT for sponsoring this debate. I would also like to thank Dr. Weiner and Mr. Moore for participating. Some challenges facing the Board of Health now and into the future are: first, being prepared for future pandemics. The second challenge is making sure that the biotechnology industries moving into Burlington are following all Board of Health regulations. The third challenge is being prepared to address the effects of climate change. Climate change could result in more disease-carrying insects and flooding. Finally, the Board of Health must be prepared to meet the diverse physical and emotional needs of all the residents in town that may result from adverse weather-related events, as well as other unavoidable situations that may arise. I feel well prepared to take a seat on the Board of Health. I have been preparing to do so for some time by watching board meetings on BCAT, meeting with Director Luminello and Associate Director Green, reading about the accomplishments of the Board of Health in the annual town reports, and reading about the many regulations and areas that the Board of Health is responsible for. Current and former members of the Board of Health have served admirably, yet most have not had a background in public health. They have had the ability to listen to all points of view, compromise when appropriate, and learn from the highly trained staff on the Board of Health. I possess these qualities and look forward to serving on the Board of Health. Again, I respectfully ask for your vote on April 9th. Thank you.
Thank you very much. And your closing statements, Gayle DeMore.
I too would like to thank the press and Alan for being here and BCAT for hosting the event tonight. It's been a great opportunity to be here and hear what both candidates have to say. I have been involved with the community for many years in different ways. I'm looking forward to stepping in and working together with the current board members to continue the good work that they do. We have to be honest here, they do great work. In the wake of the pandemic, I would like to take the time to better understand what our community needs really are and help work towards the new normal, getting a better understanding of what we need and putting that together with what the board can do for our residents. Having a public awareness, I misspoke there, but having a background working in a public school as a health educator, I do feel that some of the board's current responsibilities are somewhat of my wheelhouse, and I'm very comfortable with those. Some of them I would be learning, but I'm open to learning and I'm willing to do the work. I do work hard. I work collaboratively. I like working with people, and I would like to be on the board helping them solve some of the issues that come up with the scope of responsibilities that the Board of Health encompasses. There are so many that they could go on forever. The biggest things that I would like to be a part of is maintaining the process of the life science companies coming into Burlington and making sure that everything is safe on that end of things. I would also like to help with the educational opportunities offered through the Volunteer Reserve Corps, and I would also like to work collaboratively towards addressing mosquito control with the standing water issue that we have, while not disrupting other aspects of our environment. I do encourage residents to get involved as well and do their part, be knowledgeable, start watching, being aware of what's going on with the Board of Health, be aware of what's offered from the Board of Health, and just know that if I am elected, I will strive to uphold the mission of the board, which is protecting, promoting, and preparing our community, the residents, for whatever comes before us. And I do respectfully ask for your vote on April 9th. Thank you.
Thank you very much. And finally, closing statements, Ed Weiner.
As chairman of the Board of Health, at each meeting, I thank BCAT. I thank BCAT for all that they do in keeping this community informed. They do an outstanding job, and thank you tonight. As an experienced leader, member, and chairman of our Board of Health, I've worked to maintain, update, and improve public health within this town. I have visibly worked to develop new and innovative programming, ensure appropriate town development and redevelopment while providing the scientific expertise as we move into an era of biotechnology and away from the memories of COVID. You've all seen my commitment. You've seen me on Channel 7, front pages of many of the newspapers, including the Globe and the Herald, fighting for resources for this town. My visibility and my track record of making Burlington a better place to live has never stopped. I've kept all my promises, keeping this town safe and well, making public health a necessary priority through regulation, inspection, and innovative solutions. I've worked very hard to clean this town, a once highly contaminated community, and ensuring that this will never happen again, and provided programming and resources, health clinics, education and training, even how we handle household hazardous waste. Developing and now recognized for its excellence, the Burlington Volunteer Reserve Corps was a project of mine to be ready for all of these types of emergencies that we've gone through, and necessary public health program. And most of all, I have provided and will continue to provide future success, safety, and wellness to our town of Burlington. I again ask you for your vote. Thank you.
Well, we've reached the end. In closing, I'd like to thank all of the candidates, Ed Weiner, Janice Cohen, and GAYLE DAMORE, not only for sharing their vision with the people of Burlington, but also for offering their time and their service to the town. Thank you to NICCI KADILAK of the Burlington Buzz and Chris Flaherty of BCAT. And finally, thank you to Jen Dodge and the rest of the staff and volunteers here at BCAT. Remember, Election Day is Saturday, April 9th. The polls at the high school are open from 8 a.m. to 8 p.m. Here's your chance to have a direct say in how your town is governed. Make sure you take advantage of that right and responsibility. And thank you very much for watching.